We're going to just again update the Board of Education and the community tonight regarding our return to learn stages. As a reminder, made up of 4 stages. Right now, we're currently in stage 3. Just want to say that our goal continues to be to get students to full in-person instruction as quickly as we can. I'm very pleased with the progress we have been making, and based on the progress we're seeing, I am confident, if not optimistic, that we will begin the process of identifying more students to come in more frequently, and I am very optimistic about the fall of being in a position to returning to full instruction, at least as an option for some of our students. We continue to monitor our health metrics, and as best we can, and all of our metrics currently, as you can see, fall within the green category. The community positivity rate continues to trend down, and as of Monday is just slightly above 3%. Our PPE and cleaning supplies continue to be at the adequate levels. Our COVID screening results indicate a low instance of asymptomatic individuals attending school, with less than 0.5% of samples indicating a presumptive positive finding. There have been no concerns with the wearing of face masks and maintaining social distancing while students are participating in in-person instruction. We have seen a decline in the number of staff who are unable to report to work due to COVID-related issues, which allows our staffing levels to be sufficient. Again, we have more information on our COVID dashboard, and as I indicated on the first slide in my first comments, because of this and because of where we are with the metrics, I remain very positive and optimistic about our ability to begin to gradually look at additional students to be served and supported in person more frequently. As you may know, the CDC released new guidelines on Friday. We are currently in the process of reviewing them and unpacking them to great detail to determine what, if any, impact they will have on adjusting our plans and our metrics and our mitigation strategies moving forward. Just a quick update on COVID surveillance testing. Our COVID screening is being fully implemented. We have continued to see the number of students and staff who have opted into the testing increase slightly. We're still not at the 70% we indicated early in this process that we would like to be at. We continue to promote through social media and principal-directed emails to our families. However, we are meeting the benchmark set within the new CDC guidelines of minimally testing 10% of those that of your population. So we are well above that currently. As we have finished 3 weeks of testing, like I mentioned a moment ago, we continue to have less than 0.5% of samples identify individuals in need of additional testing. And while this is great news, we have some areas that we are looking at for continued improvement. We're seeing that not all participants who opt in are providing a weekly sample. Sometimes they forget or haven't done so. And additionally, as we're processing samples, we're finding that not all participants are remembering to put the labels on the test tube, which means we can't run the sample. And some individuals are placing labels horizontally on the test tubes, which means it's difficult to scan at the lab. So some areas that we need to continue to address there. In order to help address these issues, the communications department is providing each school with a communication kit. It will include ways to remind students and staff when it is their scheduled day to bring in saliva samples. Additionally, it'll be to include reminders on how to put the unique barcodes onto the test tubes. I just referenced a minute ago, and as you may know, the CDC updated their guidance for reopening schools on Friday afternoon. We have read the new guidance and are currently in the process, as I mentioned earlier, of unpacking how it will influence our day-to-day practices. The good news and encouraging news for us is that many of the adjustments the CDC made and the adjustments that we made in January are highly aligned to the new recommendations. We see a lot of the things what the CDC has come out with it in place in our current plans. The CDC continues to identify 3 essential elements that need to be in place to safely reopen and remain open for in-person instruction. However, they have made some adjustments to the details and provide some much-needed clarification in some other areas. So they continue to focus on the importance of layering mitigation strategies and the need for consistent implementation. In addition, they've clarified that schools should prioritize face masks and social distancing, including the use of cohorts or pods, which again makes larger school settings more difficult because of the number of pods and students to come in for more in-person instruction. Monitoring of the community transmission continues to be a core element, but they have adjusted how the metrics are monitored. They are moving away from reviewing the 14-day rolling averages and instead have based guidance on 7-day rolling average. Additionally, they are recommending that both health metrics be taken into consideration when determining community transmission, not just one, as had been in past guidance. CDC's recommendations continue to call for a phased-in approach, where mitigation strategies and learning modes are based on the level of community transmission. They have made the following adjustments. The phases have been reduced from 5 to 4 categories. Health metrics have been adjusted to reflect the use of the 7-day rolling average. And they've differentiated guidance for schools that have a COVID testing or screening program in place, allowing for hybrid instruction even when community transmission is at a higher level. Finally, the updated framework identifies that 6 feet of distance is required when community transmission is high or substantial and should be done to the greatest extent possible when the community transmission is low or moderate. In addition to 3 core elements, they've identified 2 secondary strategies: COVID testing and vaccines. These provide an additional layer of protection for schools. For COVID testing and screening, they provide guidance on how to best approach that. So we had some public comment earlier about kind of our changing of metrics and approaches. Again, as you've seen, updated guidance as we learn more about the virus, science becomes more clear. As we continue to move forward, there are updates to guidance and metrics and that we review and look at. And so we are consistent. And again, there are multiple layers of agencies that we have to align with, from the CDC, the Illinois Department of Public Health, to Page County Health Department, and others. In addition to the 3 core elements, they have identified 2 secondary strategies: COVID testing and vaccines. These do provide an additional layer of protection for schools. For screening programs, the CDC recommends testing should be done when community transmission is high, substantial, or moderate levels. Testing should be done at least weekly. And then, as I mentioned earlier, at least 10% of students should be screened. And finally, they indicate that testing should be voluntary. And actually, the CDC states it would be unethical to make the testing required. So that is a conversation that we've also had as well. Currently is an opt-in process that we have here. Finally, CDC addresses vaccines, indicating that as an additional protection, but not necessarily required to reopen schools. I remind schools that a fully vaccinated staff member must continue to implement all the mitigation strategies, including wearing a face mask and implementing 6 feet of social distance. And the CDC encourages schools to work with the health department to support messaging and outreach with families once the vaccine is widely available. We will continue to review these recommendations, and we'll make adjustments to our return to learn plan where appropriate. Again, the new guidance for us, we believe that the guidance is really aligned to a lot of the work that we are doing. We will will be updated regularly as new information becomes available. We'll likely, again, make some additional updates. I'm going to transition to Dr. Knowlton here for an update on the COVID vaccine and where we stand with that. Again, we've had some public comment and both written comment and others about the availability of the vaccine to educators. Rich, if we can go to the next slide, please. That is something that Dr. Knowlton is continuing to monitor. I will express my kind of frustration with the lack of availability, which isn't necessarily a local problem, it's a national problem. And while CDC says it's not a requirement, or it's just a portion of it, I think it is a layer of the mitigation that is very important to, especially in our larger settings where we're bringing more individuals together. Dr. Knowlton is leading our work on the vaccine and the securing of the vaccine, so I'll turn it over to him for an update.
Sure, just a couple quick comments. We're happy to know that many of our staff are actively pursuing access to the vaccine through a multitude of channels in the community. One of those being Edward Elmhurst Health, which has facilitated access for many of our teachers and other staff in this district. I continue to ongoingly pursue access through Osco Pharmacy as well as Meyer Pharmacy. We're running into the third bullet, which really reflects the issue nationally and locally. Like Mr. Bridges referenced, the scarcity, the lack of supply, the lack of volume is what we're running into. We have partners that are ready, willing, and able to go forward with setting up mass vaccination clinics on site in schools. The simple issue is that there's not available vaccine at this point. We're hearing some hopeful news that some of this will be provided through federal routes rather than relying solely on the county health department. And then lastly, I know I said this before, but anybody who's listening, watching, or interested, if you fall into the 1B category, do everything you can to take a shotgun approach towards accessing vaccine. I've listed some of the common resources up there. I wouldn't put my eggs in one basket. I'd try through as many as possible channels. You're not bothering anybody by doing this. You're setting yourself up for success and trying to maximize the likelihood of access.
And before I talk about communication, I will simply say that I know, to the board, you may have seen in newspapers, social media, and other print reports, or media reports about some districts within our county, districts in other counties, saying that they're able to secure mass vaccination sites in order to vaccinate their staff. It hasn't happened here, not because of a lack of willingness, readiness, preparation, and just having all systems in place in order for us to do it. It really comes as a result of really not an articulated or a clear plan from the state level down to the local level, perhaps even the federal level, on the distribution within each of the groups. Counties locally, regionally, have even taken different approaches in terms of within the various categories on who gets vaccinated. Kane County, Lake County, McHenry County, for example, have taken a different approach than we've seen in DuPage County on the available vaccinations. Some of the districts that we have seen have that have been able to vaccinate staffs are smaller staffs. Fewer people to be vaccinated, with a limited number of doses that are available per county, in our county per week. About 10 to 14,000 is what we've been averaging. Their smaller staffs with a smaller allotment are able to get vaccinated. And it's not, again, come because we haven't prepared, we haven't tried. Dr. Knowlton's on the phone and email multiple times every day with our contacts trying to secure this opportunity within our community. But the size of our staff, the number requires that we have a significant number of doses, and that haven't been allotted to us. Simple local partners in some of these smaller communities or smaller school districts have reached out and said, hey, I've got 200, 300, 500, we can do your staff. Again, here with our employees and contracted services, we're looking at about 3,500 plus eligible 1B people to be vaccinated. So Dr. Knowlton will continue a yeoman's effort in terms of trying to bring that here for us and for our staff. Communication, again, our primary resource will be our Return to Learn page, where we have an updated FAQ, which again will be updated by a lot of questions or comments that were made during public comment today, both the oral and submitted comments. Updated dashboard will continue to be done, and Talk 203 and additional messages will be sent out. Again, I would refer our families to previous Talk 203s regarding communication regarding a positive clinical finding or any surveillance testing that is being done. Encourage you, again, phone call comes from the county or from a school district, please answer that call and assist us with that contact tracing, which is an important part of previous and current updated CDC mitigation strategies. So with that, again, it's been a challenge for all of us, kind of navigating our way through this whole process, and I know for our families who have really put a lot into it and things that they haven't necessarily signed up for, and I recognize that. I don't want this to sound hollow or that it's without empathy or without sincerity. I get it. I understand, and I'm sorry for the frustration that you're experiencing. I am committed to getting us back fully 5 days, as many students as are willing to come in as soon as possible. We have a lot of layers that we have to work through, kind of like as I indicated through, I don't want to compare this to a snow day or anything like that, but there are a lot of multiple layers that we have to work our way through. When we look at other districts, it's size of district, number of students, space available, number of staff, percentage of students who want in. I've heard, some, people have said, why is this district or that district fully in 5 days? Well, because 25 to 35% of their kids are opting for in-person, not the 72% that we're currently at. So there's a lot of things that are at play here in terms of getting ourselves into a return to learn plan with more in place. Our primary goal has been getting kids in class as often as possible, as quickly as possible, within the guidance that we can. So that'll continue to be our driving force.